Yeah, so postoperative care for a tummy tuck is really basic, simple stuff the way I tend to run it. I will tell people that the two most important things are to stay hydrated and to walk around, move around a little bit. The binder, which is used for support, does not have to be on super tight. I like people to wear the leg stockings for about, at least a good week, probably about 2 weeks, and there's actually no maximum time. This is a procedure that historically used to have higher problem rates. The big one we worry about is people getting blood clots in the legs and those blood clots traveling to other areas of the body. That is something that's really rare when we do these things with more contemporary techniques, and especially people like me that do this all the time, there's very low problem rate. So those are the two biggest things: walking around, moving around a little bit, and drinking liquids to start. If you are hungry, I let patients eat rather early, but they don't have to force themselves if they don't want to. It's one of the procedures where I tell folks that your family may want to be very helpful, but they can be too helpful. I don't want them to put you on the couch and then attend to every one of your needs for hours where you're sitting immobile for a long period of time. So what I say is about every hour, make sure you're up walking around, back and forth in the room, around the couch, something like that. You don't have to get up in the middle of the night to walk around. You can just do that while you're awake, but I don't want someone sitting for 5-6 hours straight the whole time. So especially important in those first couple of days and actually the first couple of weeks after the surgery. The risk for those problems pretty much is higher within the first 6 weeks. If you get that far out and nothing happens, it's very unlikely to see that problem. So most of them actually happen early on if you're going to have an issue. Other things are being careful when you're coughing. If you have to cough, something like that, you can put a pillow around the belly to kind of do what they call splinting, just so that you don't stress those stitches too much. And just take it easy when getting up from laying down or sitting down and standing. Do it slowly in the first few days, because sometimes the blood will rush to the legs and they may get lightheaded. You don't want to see that happen. So it's mostly common sense things like that. How we handle maintaining the drains and things like that, we'll all go over all that in postoperative care instructions and in person, on the phone, email, talking, we're never out of touch. So we go over all those other basic things as well.